Arganissima, New York. Your exotic skin, hair, and beauty source, and your one-stop shop for all your natural and organic skin and hair care, featuring authentic organic Moroccan oil and prickly pear seed oil and much more. Bringing you only the best, straight from the source and proudly produced in the USA. So what are you waiting for? Shop today at www.arganissima.com. Arganissima, New York. Your beauty is our duty.
Folks, welcome back to the iHealth channel, iHealth Radio, with your host, Hurricane H. Here, new day, new show, new topic, new guest, still in the same model of discussion. And today, again, we're talking about patient advocacy. And I have with me a guest who is going to take us through a journey. And she is an advocate. She is passionate about this topic. She is also an author, writer of a book that, that will inspire you, that will guide you and help you eventually maybe face some of the dilemmas that, she personally had faced and knows that other people may have challenges and out there in the healthcare. So healthcare is actually having, just in general, tough time in a lot of ways. And sometimes navigating the system can be hard, and having access can be hard, knowing what to do, patient rights, and all this stuff can be complex. And so today, again, our guest is going to shed some lights on that and give us some real spin on things, and based on her true experience, which is something that you had to deal with for a few years, I guess, and for some time, and she took it upon herself to take this mission on the road. So with me today, Melissa Mullamphy, and she is going to help us today. So Melissa, welcome to the show.
Thank you very much for having me.
My pleasure. My pleasure. So first things first, I know you and I briefly discussed a little bit, something inspired you to do this work. Let's talk about that. Who is Melissa? How you got into this? I know you have a background in psychology, so that's an interesting, background, and it got you to this journey. So let's take us from the top, from everything, the beginning to now, and what happened, the stories behind this, and then also let's talk about the healthcare today, post-COVID, pre and post. I mean, there's a lot of changes that happen in this world. So let's go over that.
Sure. My background is, as we spoke, it's a little eclectic. I have a master's in psychology, but I worked in corporate America 20 years. I did a lot of nonprofit for veterans. I worked in psychiatric emergency rooms. I worked in step-down houses. I worked with addictions. Found myself again in corporate America on a totally different angle for 20 years because that's what paid the bills. What brought me on this journey for patient advocacy is, in May of 2010, my mom called me. I just got back from vacation, and she was saying she had a stomach ache. So, me playing doctor, I was like, all right, Ma, my mother would never go to the emergency room. My mom was waiting tables the night before. She was 68 when she passed away. She was walking around with trays full of spaghetti the night before. Never went to the doctor. Her generation, they're called the silent generation. They're not doctor people. They don't want to be burdens. My mom never went to a gynecologist since she had me. She was diagnosed when I was 39, and she didn't want to go then, but she didn't have a choice. We brought her to the emergency room. We got her to go, and her stomach was very distended, and I had seen her a week before, and I didn't notice it. Because she was wearing like extra large shirts. So when she got to the ER, the doctor took one look at her and, did a CAT scan. And again, me and my sister were like, nah, it's probably nothing. She's probably obstructed, a little surgery, no big deal. And, when he came back with her results, while he was trying to say that, what they did was they found a 23 centimeter mass. And while his words said, these things are usually benign, his facial expression and nonverbal communication said otherwise. And he asked to speak to my father and my mother privately. So, that's when your heart drops and you're like, oh my God. So that was, one Saturday night in the hospital, ER, she got discharged. They said, follow up with your general practitioner. And, our general practitioner, I call him Dr. Cool in the book. He's old school. And, he lived right up the road. I called him on a cell phone, Dr. Cool, what's going on here? And, don't worry, Missy, it's probably benign. We'll see you Monday. So we did everything almost as a family unit. And so my dad, my sister, my son, who was a toddler at the time, all go into my mom's general practitioner's office. And, he takes one look at her and he's like, oh my God, she looked like she was 4 or 5 months pregnant, because ovarian cancer is what her diagnosis was. You get a distended abdomen because it fills with fluid. And again, he was saying to us, probably benign, this guy, they don't make him like him anymore. He was, trying to, keep us calm. But when we left the appointment, he also gave us 2 referrals to a gynecological surgeon, oncologist, and an oncologist. So when you get those referrals, you want to think it's benign, but you still got the referrals. So, what was, I shouldn't be shocked, but what was shocking to me at the time is, we got these referrals. We're all scared to death, right? And we had to make appointments. She had to be seen. I mean, she has 23 centimeter mass, and, you're just a file, man. I mean, you can call and say, listen, this was found in an ER, but you might still have to wait a couple of weeks to be seen. And, with the way I operate, my temperament, maybe it's just being from New York. That's not a good answer. So, it took us a while, but we wound up getting an appointment within, I would say, a week's time, which was good considering. And, to make a long story short, she was diagnosed with ovarian cancer, stage 3C. The thing with ovarian cancer with women is it's called the silent killer for a reason, because a lot of women, the symptoms are very similar to GERD, like gastric reflux. People eat Tums. They might have a urinary tract infection, so they treat it. Even doctors will prescribe antacids and say, you're fine, see you in a couple months. I mean, that's just how it works. And unfortunately, because of that, and also because my mom never saw a doctor, a lot of times when women are diagnosed, they're staged out. They're not like usually 1 or 2, they're, 3 or 4. And there's no there's no mammogram, there's no pre-screenings that you can do for ovarian. The only way to find out that you have it is either you showing symptoms like a big belly, like my mom had, and you get a CAT scan, or if you're lucky and you push, you can get an ultrasound. And there is a blood test, but the blood test is more directional. And a lot of doctors aren't going to do it unless they really think there's a risk. So all over my book, all over my blogs, I push, if you have these 3 symptoms, don't take no for an answer. Demand you get these things done. And if they don't, I just read a story the other day of a 40-year-old in 2020. She had these symptoms. She was on the Today Show and she passed away, but, they told her it was nothing, they gapped her off, and she wound up finally, like my mom, going to emergency room. They did a CAT scan and it was, a lot of times when you're in CAT scan territory and you're big and it's left the ovary and it's in other parts of the body, it's not good. I mean, they haven't updated the treatment protocol in 40 years. I mean, they try different stuff, but realistically the same protocol, chemotherapy and what they call debulking surgery, is the treatment of choice. And, it's a crapshoot. So to get to where you asked me where I came from with this is of why I wrote the book was a couple things. One thing is that when we finally got the diagnosis, my mom, it was weird. She had to go through all this pre-op testing, and basically she had to play catch up for the last 40 years of not getting blood tests, not getting mammograms, not getting a colonoscopy. So before she could be a surgical candidate, she had to go through all these tests, and they had no baseline to look at it against. So that took time, right? So after she got through all these tests, we were scheduled to surgery. We're like, let's get this stuff out yesterday. I mean, she was scared, but we had to do what we had to do. And unfortunately, she had a platelet issue. Your platelets, the normal range is supposed to be between 200 and 400,000. She was 1.2 million. That's cancer causes that. So because of that, she was a stroke risk on the operating table. So, we all showed up, my dad and my sister and my son, we're going to get this stuff out. And 3 doctors were in the room, and they canceled surgery because the doctor, who I call Dr. X, actually Dr. Z, I had to change names. Dr. Z was not comfortable with it. And, at the time we were mad, because it's like, with cancer, you got to get it out. Right. But we were like, oh, come on, you got to do this. But she was right. She was right. And you find out later in the book that every hypothesis, everything that this doctor thought would or could happen, did happen. Eventually, in the beginning, my sister and I would call her the Grim Reaper, because it was like every time we spoke to her, it was bad news, or this isn't a friendly cancer. I'm concerned about your mother's case. And we're like, come on, man, give us some hope, But she was right in every call that she made. So with that cancellation, they said, okay, at that time, they were just going with a diagnosis because of the CAT scan. And she was also anemic, so the blood work. So she said, okay, we're going to order a biopsy. You'll have the results in 24 hours. My mother was admitted. 4 days later, not 24 hours, 4 days later, we're sitting in my mom's room. We're still, kind of working on the whole hope thing. You're Googling, all this stuff about alternative care and what the statistics are of benign versus, malignant, and your mind starts going crazy. And my sister, my mom, and I are sitting in her room, and a nurse comes in, and she's got what now is like COVID protocol gear on. She's got like a face mask. She's all yellow, like she's dressed like she's going into warfare. Exactly. And so my sister's like, we're like, can we help you? And she's like, oh, Miss Burns, I'm here with your chemotherapy to start your treatment. And we're like, what? What do you mean? What treatment? What? We didn't even know she had cancer. And this poor nurse was, she just pulled the short straw, but we had no diagnosis. We had no doctor assessment. We had no staging. We had no prognosis. We had no nothing. So my mom immediately began to cry. And the nurse, she was nice. I mean, she was just doing her job. My sister asked her, again, this is 10 years ago, why are you dressed that way? What's going on here? And she's like, oh, well, we all know chemotherapy is poison. It is poison. I mean, it kills the bad and the good cells. She's like, I can't get this on me. And at the same time, she says, I can't get this on me, give me your vein, So that was how we were told my mom had cancer. And it just kind of started at that point and just went south from there. When my mom agreed to the treatment, I got on the phone with her oncologist, read him the Riot Act, said, basically, you need to get here now and give us information. This is not acceptable. The whole thing, he came over and he did, he told us what they had found and all that stuff. And, what are you going to do? You can't change it. So what they decided to do was, because my mom had this platelet issue and was a surgical risk, it's not uncommon that oncologists these days will say, we're going to give you 3 rounds of chemotherapy with the theory that it's going to shrink the tumor, therefore make surgery easier, not as a big surgery. So we're like, it sucks, but okay, we got to do what we got to do, right? So she did the first round of chemo, and it was okay. It wasn't as bad as she thought. It was kind of a layup. We got discharged, and then started the schedule to get to June and do a couple months and then possibly consider surgery in August. And that's kind of how things started. Wow. So and then I mean I could just keep going through the story. Is that she gets the second dosage in June. And this whole time I was working full time, commuting. My sister was watching my son. So like, again, another thing that I talk about in the book is within your family, everybody's going to take a role. For me, it was, I often had to be the bad guy in the story, but we'll get more to that. But my sister took my mom to a lot of the appointments. She wrote down a lot of things in a journal. She updated family members in email. Like, everybody had a role. My dad's old school. My dad does not handle stress well at all. So he came, he was supportive, but he was just, trying to function because, he was 40 years with my mom. You know what I mean? So, she had the second round in June, still doing okay. But she was starting to waste. Cancer causes what they call wasting disease. You never see a heavy person with cancer, right? Because it eats the good and bad cells, and all the calories that you intake, it gets rid of them. So she was starting to waste. Mentally, she was not great. I do have some guilt looking hindsight because, at this stage, like, she didn't want to eat, and we're like all trying to be positive Polly, and, Ma, you got to fight, you got to eat, you got to try, a little bit of tough love, try everything, green drinks, mushrooms, you name it, we tried it. And she was starting to waste. And so she got the second round, and we said, listen, she was ready to get the third round. And we said, we want to get a CAT scan before we get the third round of chemo, because she doesn't look good. She doesn't feel good. She doesn't sound good. And we're not going to continue down this path if it's not working. So they said, okay, they did a CAT scan with contrast. And we were ready to get the third round of chemo in the chemo suite, they call it, by the way. It's called a suite. It's not a suite, but that's what they call it. And my sister met with the oncologist, and they said a tumor shrunk in half. So we're like, oh my God, that's awesome. It's working. That's amazing. Like, we're doing the jig. So we got the third round of chemo. Week after that, my mom met with the surgeon who, Dr. Z, and she looked at the film with the radiologist and explained to my family that the tumor hadn't shrunk at all. In fact, it grew. The chemo hadn't touched it at all. So we just did a third round of chemo, made a sick lady sicker. Also consider, besides physically, mentally, what that did to her mind and trust and hope. And we're like, okay, well, plan B, we need to get this out, So in August, again, she was wasting, and, we said, we need to make an appointment. We need to get this out yesterday. Just like now, when you try and get appointments, it's worse now, but with 3C, that means that it could be on the colon, it could be on the small bowel. So they needed to have a GI surgeon in there as well. So you had to get an anesthesiologist, gynecologist, oncologist, surgeon, and a GI doctor all together on the same day. This was beginning of August, end of July. They told us October. I said, what? October? She'll be dead by October. So, we can't help you. Bad answer. So, my mom, my dad, and my sister were in the surgeon's room, and, me and my sister, polar opposites when it comes to this stuff. She's, she was even keeled, trying to, keep things calm. Me, I'm the firecracker. I'm pissed. And, all of the secretaries that schedule for the surgeons were in a room next to where the doctor's offices were. And I just, from the waiting room, I opened the door, I got a chair, and I sat down. And they said, "You can't be in here." And I said, "I'm not leaving until you schedule my mother." And they're like, "You can't be in here." And I said, "Call security. I'm not leaving," and Dr. Z knew that, I wasn't going to leave. I would have slept there. They would have had to pull me out. By October, she's gone, and she was already suffering. So Dr. Z got on the phone. She starts making phone calls. She's pacing up and down the hallway. I'm sitting in there. Nobody really wants me in there, but I really didn't care. And they wound up, thankfully, scheduling her for August 3rd. And, she had to get 2 weeks of, they call it TPN. It's like liquid food in order to be strong to survive the surgery. The night before the surgery, Dr. Z comes into my mom's room. It's late at night, and I'm there with my sister, and she pulls me out, and she's like, "I'm not really comfortable with your mom's case. I think it's probably going to be palliative." And if you know what palliative means, that means not curative. Try to make the person comfortable. You don't want to hear palliative when you're talking about cancer. So I'm like, "You're telling me this now at 9:30 at night?" She's a 6 o'clock case. But again, looking hindsight, I didn't want to hear it, but she was being honest. And I can't tell you how much I appreciate that now. I didn't at the time, but again, you need to have transparency. You need to have communication. You need to know everything. And so she basically told me, she's like, if, when your mom gets brought down to the OR, if you see me in like an hour, that means we opened her and closed her. We couldn't do anything. And so we arrived the next morning, and I knew this, but I wasn't going to tell my dad and my sister this. I'm just sitting there like, nervous as hell, and just, hoping that I don't see her come out soon. And she came back 9 hours later. So they optimally debulked her. That's what they call it. They got everything except for microscopic. And I'm sure you've heard that before. And my mom was in intensive care for a couple of days. Never saw my mother intubated. That was another thing where, if you've never seen one of your loved one intubated, man, it's scary. And the good news was that she survived surgery. They said they had got everything. And the next step was to do inpatient rehab, because she had to, move around. I mean, when they optimally debulk you, they pretty much gut you. I mean, they took out everything they could possibly take out. And, from like her pelvic bone all the way up, she was cut. And so she went into inpatient rehab, and, she was a waitress. So she was always a late person. She'd get home 1, 2 o'clock in the morning. So, having PT show up at 8 o'clock in the morning and say, "Come on, you're going to get on the treadmill." She didn't really dig, but you got to move. I had an issue with one doctor in the inpatient rehab. My mom called me, and she was put on another medication. And she's like, "I feel really dizzy. I don't know what's going on." So I said, what's the medication? And thankfully she was cognitively intact, and he put her on a high blood pressure med. But my mom was always low blood pressure. She was called hypotensive. She's always running at like 100/70. So if a doctor gives you a high blood pressure med, he's going to bring it lower. And what's going to happen? You're going to pass out. So I said, "Ma, don't take it. I'm coming over." Like, this was just literally these little things that I'm talking about probably happen 3 times a week. And thankfully I work for a job, a corporation that the executive vice president knew what I was going through and said to me, "You got to leave, you leave. You need to take off a couple of days. We'll sweep up after you. Nobody wants to be in your shoes. Do what you got to do." So I can't tell you how many times in 8 months I just packed my stuff and, left work and went to the hospital or the physician's office. So with that, I left. I went and I saw the prescribing doctor. He was in charge of the rehab. And I said, you put my mom on hypertensive meds. Why? And he basically, my husband was right there. He's like, I'm the doctor. You're the family member. I know what I'm talking about. Don't question me. I'm wordsmithing, but that was his attitude. And I said, okay. She's hypotensive. Did you read her chart? You know what? Because if she falls and breaks a hip, you're 100% responsible. And with that, again, these are the things you have to do. Like you don't want to have to do them, but you got to do them. You're not going to get things to change if you make a phone call a lot of times, because as everybody knows, you're getting Silicone Sally, or you're waiting and you're 3 people deep to try and get a doctor. It's very hard to get a doctor on the phone. So I got in my car and drove over to the cardiologist's office. That's the person that managed her cardiac issues. And I just walked into the waiting room and they're like, you don't have an appointment. And I said, I know, but I need to speak to Dr. So-and-so. They're like, well, you don't have an appointment. I'm like, this is an emergency. And so she came out. She was like, okay, who are you? And I let her know. And she's like, why would he put her on a hypertensive med? I'm like, that's the question I'm asking you. And with that, she discontinued it immediately. And, she got off the meds. And that was that. She got out of rehab. And the next stage was supposed to be what they do, cleanup chemo, because don't forget, they left microscopic in there. Mm-hmm. Cleanup chemo was inpatient, 4 days inpatient. And I was at work and, my mom, mentally, she was feeling better. She'd gotten out. She was, healing. She was able to eat a little bit and, let's just bang out this 4 patients of inpatient. Maybe I get my life back. Right. So she, the first day they hang the bag and everything's okay. But then I get a text from my sister. My sister's very conservative. She doesn't curse. But in the text, it said effing terrible. And I'm like, so I Googled the meds, it's called ifosfamide. I Googled the chemo agent that they were giving my mom as cleanup chemo and printed it out, left work, went over to the hospital, took one look at my mother, and she had every symptom of toxicity except coma and death. I mean, every symptom. She was hallucinating. She was throwing up every time she moved. She was, it was just her breathing was labored. It was bad. So it was September. It was Labor Day weekend, and I knew that her oncologist had a boat. And how we think up here, you got a boat, you're gone for the weekend, especially 4-day weekend. So I called him up and I said, listen, before you leave, I need you to come to my mom's room and see her, because I don't think this chemo is good for her. And, he came, he took one look at her and basically said she was fine. He told me to stay off the internet. And, unfortunately, my family, you have that white coat syndrome. What that means is, a lot of people have it. They see somebody with a white coat on and they're the professional, they're the expert. You're going to listen to them because they know best. So my family were like, okay, my mom opened one eye and said, I'll do the second bag. The next morning I get a call from one of the nurses. Now we had been in and out of the hospital so much. I befriended a lot of nurses. That's so critical. If one of your loved ones is sick, you have to befriend your nurses, not only because you should just do it to be a decent human being. You do it because they are the connective tissue between the doctor's orders and your loved one. They can make or break your care. And we met a lot of good ones. And one of the head nurses that had seen my mother before called me on my cell phone. It was a Saturday morning and said, Melissa, you need to get here because this isn't the Connie that I know. Because don't forget, she had been in and out a couple times. This nurse was sticking her neck out, not just following orders. And I went there, saw the same thing. And, now her regular doctor's gone and I have to get somebody from his group. Somebody from his group comes over. My father shoots over. My sister shoots over. We're all standing in the room. The guy comes up and he's, he looks at my mom and he's like, for Connie, we're going for cure. For cure, we have to be aggressive and you got to keep going. And again, my mother opened one eye and unfortunately, I wish we didn't follow the orders, but she opened one eye and said, just she was kind of like, just get it over with. I'll suck it up, just get it over with. So she got the second round and I went the next morning and I went early. Another thing I say in the book, if someone is sick and in the hospital and they're your loved one, boyfriend, girlfriend, whoever, go at different times. Don't always go at 7 o'clock at night. Doctors usually make rounds in the morning. They usually make rounds between 7 and 10 before their office hours start. So if you can get there in the morning, that's when you're going to get a doctor. But you also want to go at different times because you might catch something. So I show up as soon as visitation starts. Mm-hmm. And I found my mom flat on her back. She wasn't elevated. Her arm was hanging off the bed, and she had throw up coming out her mouth. And she could aspirate it. I went from like 0 to 100 in 10 seconds. Nurse came in, and now, at this point, I mean, she was poisoned. And now I don't trust you. I don't trust anybody here, and I'm not leaving. So I wound up staying over. My sister stayed over. It was a horrendous weekend. She was hallucinating. Every time she moved, she threw up. It was god awful. And Monday afternoon comes around, and who comes in but the guy that said she was fine on Friday. And I'm leaning up against the bathroom door because my dad was there. And believe it or not, because she was so bad, priests had been in and out of the room. That's how bad she was. And that's another thing. Like, whether you're religious or not, you don't really want to see a priest if your loved one's sick, because it's not a good sign. Mm-hmm. And he looks at me and he says, "You're right. You were right. She was toxic." And then, then my New Yorker side came out, and I said, "You beep, beep, beep." I'm like, "I'm in reinsurance. This is your beeping job." And with that, she pretty much lost 3 weeks of her life. She was pretty much, the toxicity and what it did to her. She didn't get discharged for like 3 weeks after. She was like in and out of consciousness. Priest came in a bunch of times. I had to call my husband. He works in the Bronx, like 3 times to come to the hospital because we thought it was it. It was bad. She was toxic. And, with that, it was just a bad scene. Unfortunately, during the time she was in after the toxicity, she started getting ascites again. Ascites is the fluid you get when cancer's growing. And so we're like, so we said, let's get a CAT scan, because they thought it could be a bowel obstruction, but let's get a CAT scan. They got a CAT scan, and 31 days after she was optimally debulked, she had more cancer than she started with. So everything came back, and it was more. And what we found out later, going through the records and the pathology, was that not only did she have one type of carcinoma, she had 4, and they were sarcomas, which, this is I go back and forth. Had they done the biopsy correctly, they would have known that, because when they did the biopsy back in the beginning, they only biopsied the fluid around the tumor. They didn't get into the tumor. Had they got into the tumor, they would have known it was a sarcoma. Maybe they would have used a different treatment. They only tested the water, the ascites around it. Adenocarcinoma was the diagnosis, and that's what they treated with normal ovarian protocol. So when she heard the cancer was back, it was like, thinking about it, like, my mom, I think, was going through everything for us, because she suffered the whole time. Like, there was I can't remember any happiness or good days throughout that whole process. So once she heard that, the only option was a maintenance chemo. And so she's like, all right, I've gone this far, I'll sign up for it. She did 2 rounds of that, and around Thanksgiving, nothing was working. It was just bad. She was suffering. She was sleeping most of the day. And, we always said, I knew my mom was doing it for us, but ultimately it's always the patient's or your loved one's decision when they're ready to say, I'm done. And she was done. And so we got hospice to come to the home. And the weird thing is, and again, I write about it in the book, my mom, prior to hospice coming, was, she was really sick, and she was on pain meds. She was on benzodiazepines, which are anti-anxiety meds. So she was like out of it. But when hospice came, it was almost like when the lady interviewed her, she was like, she had like a little bit of bounce in her step back. She was more alert. She knew all her meds. She read down everything. She smiled. She was laughing. She was, I think at that point, she was like sort of at ease, because she was okay with it, even though she wasn't okay for us, but she was okay with being done. And so hospice came, and, one thing about hospice, again, I try and float tips throughout, just because I have so many, is they're great. It's an unbelievable organization. I could never do the job. But if you do have to engage them, try and find somebody that's dealt with the diagnosis that your loved one has. Like if your loved one is passing away of cancer, it's good to have someone with experience in cancer. They have congestive heart failure. It's good to have somebody that has experience with the heart. And the reason why is because basically hospice comes every day, and they do some basic vitals, and they tell the family how close they think your loved one is. Every day that they came, Saturday to Saturday, they told us today was going to be the day. So the messed up thing is that you don't want today to be the day, right? But it's coming. And I remember the whole time my mom was laying on the couch, like by Wednesday, started on Saturday, by Wednesday, she didn't get off the couch. And I would sit in the chair in the living room, and I would make sure her chest was rising up and down, because I was nervous that it was going to stop. But again, the mind F thing is that that's what you're waiting for. It's like, it's a weird space to be in. And, we were giving her morphine. And I remember at one point, I gave her the morphine, and I asked my sister, I said, Alicia, is it 2 milligrams or is it 1? And she's like, I gave her 2. And she's like, oh, it's 1. And I was like, oh, oh my God. And the messed up thing is that, like, if you have experience with cancer and end of life stuff, morphine ultimately shuts down the central nervous system, and that's how you pass away. It quote unquote helps you pass away sooner and without pain, we hope. So when I made that mistake, a part of me was like, did I help her? Did I mess up or did I help her? But she lasted, Saturday to Saturday, and it sucked. And there was a part where, like, me and my sister were like, maybe she's not going to do this when we're here. Maybe we need to go. But then you're like afraid to go because you want to be there. Like, you're just in this, you don't know what to do. And so that really sucked. And she passed away, and they came and got her, and we went through all the things that we had to do. But to answer your question on why I wrote the book, is one night when my mom was inpatient for, she had bilateral pulmonary embolisms, which is clots in her lungs, and DVTs in her legs. Cancer causes clots. So we're in cardiology, which she had never been on the floor. And it's after work for me. And she says to me, she goes, Melissa, she goes, never be stupid like me. She said, always take care of your health. And, don't like, my mom had guilt because she was in the predicament she was in, and maybe she could have prevented it had she gone. But finding out what I found out after the fact of the type of cancer that she had, I don't think she would have survived it either way. But the reason why I needed to write her story is because there was so many missteps, so many errors, so many miscommunications, that if I can help one family, one person not go through what my family did, my mother did, my job's done. I don't need to make money on books. I just need the message to get out and to give people the tools on what they have to do if their loved one is ill. And at the end of each chapter, I write what I learned and what I would do differently. And it could be something as simple as, you know, your loved one's being discharged. They have cancer. They have anti-nausea meds. The nurse says she called into the local pharmacy. Get to the local pharmacy, it's not there. Now you're in trouble because you left the hospital trying to get somebody who's going to forget it. You know, something simple like don't leave the hospital without a hard script. You know, have it in your hand. Even though they said they called it, get a copy. You know, I flood the book with things like that because it's things that we learn the hard way. You know, another thing, you know, my mom was in a teaching hospital. You want to be a good participant and people have to learn, right? But this particular thing, we stopped allowing students to see my mom because I was there, it was late at night, and a student came in and asked my mom her DNR wishes. Did she have a DNR and what did she want for life-saving? You know, what does she want for life-saving? My mom was jacked up on Ativan and tired and sick, and she just looked at him and she said, if there's no hope, I don't want anything. With that, he took his pen and he left. And I looked at her, I said, Ma, I said, you just told him, if you have a cardiac arrest tonight, they're not going to help you. She goes, no, I didn't. I said, yes, you did. And so I went down the hallway, I got him, came back. I said, sir, what did you hear? She doesn't want anything. So that means nothing, no life-saving measures at all. And I said, that's not what she wants. I said, what she wants is what like a lot of people that I know want. They don't want a feeding tube and they don't want to be put on a vent for the rest of their life. That's what my mom wants. And he heard what he heard and he left with that. Mm-hmm. So that was bad. And he fixed it and everything. But then it gets worse because I'm leaving and, you know, I was making sure everything was cool. Her IVs looked good and all that stuff. Her name was Constance Burns. And I looked at her bracelet and it said another name, another barcode. Yeah. So.
Oh my God.
Yeah. So if you know anything about medical files, your meds, your prognosis, your doctors, your labs, everything is on that barcode. That's who you are. And I said, Ma, you could have gone down for an angiogram at 2 a.m. and not even known it. And so I wasn't thinking. I called the head nurse. She came in. They cut it off real quick and put the right thing on. You know, throughout this whole process, I wrote to the patient advocate. Every hospital has one. And she was very nice. And, you know, you'd always get the, we're sorry, you know, we're going to talk and do this X, Y, and Z, which is cool. But I wish, and I blog about this, that patient advocates could be consultants, because the patient advocate in a hospital is on the same payroll as the doctors. They're on the same payroll as people that pay their benefits. To me, that's a conflict of interest, because while they have their job and they have to do what they have to do, how far are they going to go? Because that's how they're getting paid, you know? And I can tell you that after all this happened, after a month later, I wrote to the CEO of that hospital, and I gave him 5 out of the top 25 things that happened under his watch. You and I both work corporate. We know responsibility lies at the top. Mm-hmm. And I said, I'm not going to litigate. I'm not going to sue you. My mom was very sick. I probably could have, but my dad and my sister didn't want to. But my dad has a $5,000 net bill. I'm asking you in good faith to wipe it, zero balance my dad's account because of this. And I didn't even tell you all of the mess ups that happened. And I wasn't sure what response I was going to get. I wrote it very professionally. And in 2 weeks, I got a letter back. They zero balance my dad's account. CEOs don't do that. They don't do it because by doing that, he admitted liability. And he probably had to be surrounded by about 10 lawyers to write that letter. But you know what? It was good. It happened. My dad didn't have to pay that $5,000 to me. The amount of my mom's care was probably easily $500,000. 5,000 is nothing, but it was the principle, you know? And so, you know, they zero balanced my dad's account. And, you know, as we talked about, I mean, I have a master's in psychology. I did group therapy. I ran groups. I worked in psychiatric emergency rooms. I did counseling. I worked in step down houses. I was terrible at grief. I was pissed off at the world for years. I was like difficult to be around. I mean, thankfully my son was young. I think he's the one that kept my act together. And, you know, people handle grief differently. I write about it in the book. You know, they say there's the 5 stages of grief. Now there's the 7. You don't go through them in any particular order. It all depends on who you are as a person. And, you know, I didn't handle it well. And it took me, but also, you know, I had a master's degree in this stuff. Why do I need help? You know, I'm too smart for this. I was textbook PTSD, depression, anxiety, textbook. But I felt like because my job was so good to me when my mom was sick, I had to keep working. And they offered me to, you know, they were so cool. They're like, why don't you take 6 months mental health, get your head together? And I'm like, no, because I owe you, because I've been gone so long. You know, I felt bad. And it was probably the stupidest decision I ever made, because, you know, I was about $110 and wearing size 0 pants. And I mean, people at work knew. I mean, I would roll in at 10 o'clock because that's what time I felt like getting there. I remember one of my manager, actually, at one point, we were in a meeting and she was like kind of schooling me on being late. And I'm like, you know what, you're annoying. That's what I said to my manager. Like, I just didn't care, you know?
Well, that's depression. I mean,
yeah. And I was just in that space for a really long time. And, you know, I did wind up getting help, and I went 8 years, and I'm not ashamed to say it, because me and you couldn't be having this conversation. You know, I couldn't have the conversation without crying. Now I can, because I wrote about it. Going through the process of writing the book, it took me all this time, because when I started, I was angry at the world, and the first couple versions are terrible. I finally was able to get it the right way I wanted it to, but then I still changed it a bunch of times, and I added stuff, and then COVID happened. So I had to have a chapter about that and how healthcare is now today, and, you know, what you should look out for. And that's more of what I blog on a daily basis about is, you know, now, I mean, everybody knows. I mean, I don't know if you've tried to make an appointment with a specialist lately, but you're looking at 3-4 months. People are presenting in ERs, you know, staged out with disease because they weren't able to get that X-ray or CAT scan for 2 years. You know, we're in a lot of trouble. I mean, I tell people, man, if you can, stay out of the hospital, you know, because, and then, you know, you got the nurses. I mean, I wound up having something happen to me last October that was a crazy thing. And I was in 13 days, and I befriended a lot of the nurses, and, you know, they're all suffering. I mean, they went through hell with COVID, and they didn't sign up to be the person holding a cell phone with a person's dying loved one to say goodbye on FaceTime. Like, they're all, a lot of them have PTSD. A lot of them are quitting because of that. A lot of them are understaffed, underpaid. And, you know, with the nursing shortage and everything else that's going on, you know, it's a problem. Like, my neighbor got sick in December, and he has no family, and he was really sick. And I went to go see him. I'm not vaccinated, so I had to get tested every time I went to go see him, which was okay. I'll do it. But let me tell you something. He wound up having an aggressive cancer, came out of nowhere, 68 years old, not a penny to his name, not a window to throw it out, and he didn't have any family. So he was in a hospital, and I went to see him on a Sunday, brought him a Dunkin' Donut. He was smiling. He ambulated to the bathroom. He was talking about beating it. You know, he mentally, he was good. 2 days later, I go back because my test was going to wear out. You know, I'd have to get another test. Mm-hmm. And I walk in, and I'm not kidding. I find my friend, my neighbor, who I just saw 2 days ago, smoking and joking, looking on his Facebook, naked in the bed, no glasses on, the call button not anywhere close to his reach, and crying out in pain. And what they had done was, because of the ascites, he had it in his abdomen, they put a shunt in his stomach, which is very painful. And he was one, he had cancer. They said he was going to make Christmas, and two, he was suffering. And I walk in and I'm like, what in God's name happened in 48 hours? And so a nurse comes in, very nice, and she's like, you got to fight for morphine. And I'm like, yeah. And I mean, I've never seen anybody suffer so bad. I've seen people suffer. It was like watching. I mean, we put dogs to sleep. This was god awful terrible. This is a grown man crying in pain, audible crying in pain. And I got on the phone. I started calling people, and a PA came up, and she said, well, he's on PRN medication, which means you have to ask for pain meds. You have to tell him you're in pain, and you got to ask for it. And I looked at her. I said, does he look like he's in any condition to ask for pain medicine? He didn't even know who I was. So to make a long story short, I said, again, I got to be that person. I said, I'm not leaving until you fix this. And, 7 hours later, he got hooked up, and I called his sister. I said, you need to get here, because this doesn't look good. And, I spent that time holding him down, because he had such pressure because of the fluid in his abdomen. He felt like he had to go to the bathroom, and he was trying to go to the bathroom, but there's no way he was walking to the bathroom. And I kept like trying to make believe like, it's okay, just go, just let it go, don't worry about it. And, the whole thing. And when I convinced her to get the narcotics, I asked her, I said, listen, we both know what's going on here. Is this going to have the effect that it's supposed to have? And she said, yes. And, they finally got it up, and within 15 minutes, he was asleep with his eyes open. And I knew that was it. And I got the phone call the next night that he had passed away. But the fact that I found him that way, it just wasn't okay. And they said he was in this particular hospital because of COVID overflow. They're full of it. I walked around the floor. I would say out of 20 beds, there was 7 with people in them, and I don't like to make a habit of this, but here I go again. I got to tell somebody, because this isn't okay. And I said to his family, I said, listen, it can come from you, but I'll write it for you. But somebody's got to know how this man was left. And I wrote it, sent it to them. They didn't send it out. So I followed up, and I said, you know what, I'll send it out. I don't care. And I sent it out, and he wrote back. He was very nice and said, it's our job to, make sure that, end of life is as peaceful and as comfortable as possible, this, that, and the other thing. And, at one point, one of the nurses, because she didn't want me there, not the good nurse, but the other nurse. And she was like, who are you? And I was like, don't worry about who I am. And I said, I'm his daughter. I wasn't his daughter, but I had to say that. And, I wrote it to the CEO saying, at one point they didn't want me there. It was clear they didn't want me there. I wasn't making trouble. I wasn't being ridiculous. I wasn't being offensive. I was just being, you have to fix this. This is not acceptable. And he apologized for that. He goes, we should always treat our patients' families with, kindness, and make sure that they are communicated with, and, the whole thing. And, he wrote all the things that I needed to hear, I wanted to hear. And I said, I'm not even going to give you names. I have them, but you can just look at his file. I don't need to give you names. It's all in his file. And, so like right now, I mean, I'm not trying to say all healthcare is, bad, or all doctors are bad, or any of that. But right now, we are in a little bit of trouble, and advocacy is critical. You don't have to know everything about, medicine or labs or anything like that. You just need to be a good listener, and you need to, as I write a lot, is find your voice. It's you need to become comfortable being uncomfortable. And I said this a lot again in the book, is as much time as I spent in my mother's room when she was an inpatient, even though you're not being paid by the hospital, you are in the patient care team just by being there. For example, if I'm there with my mom Saturday and Sunday for 6 hours a day, nurses come in once an hour for like 5 minutes, right? I know if she had breakthrough pain. I know if they gave her lunch and breakfast and she just drank half a Boost the whole day. Like they don't write down calorie intake. It's not their fault. It's just not how the system works. When you have cancer, that's critical. I know if she mentally does not want to be a burden and needed something and didn't ask for it. I know if she there's so many things that by just being there. And with someone that's sick, they usually have multidisciplinary teams that meet on your loved one's case. And I said to them, when my mom was going through this, I said, listen, I'm not trying to do your job. I said, there's things that I can tell you that I think will help you care for my mother. For example, do you know she was in the hospital for 4 days and she only drank 1 Boost? That's important. Do you know that she was supposed to be on Zofran and getting anti-nausea meds, and the nurse forgot to turn on the IV, and she went 6 hours throwing up, but just didn't want to bother anybody, so she didn't use the button. Things like that. Not to be a thorn in their side, but just to get them the whole picture. I mean, there was a point where my mom needed a blood transfusion. She's old school. She was worried about bills. She asked how much was blood. I said, Ma, I'll give you my blood, but a lot of times, it's important. Like, doctors don't have time, I get it, to know every little thing about the patient. But as a loved one, there's a lot that you can add to their care by just having open dialogue and communicating. I'm not saying give me a seat at the table for your interdisciplinary meeting, because you don't want that liability. But if you don't want to hear me, let me just write something down of what I've observed over the last week since she's been in, because she's very sick, because you know what, it might help you. And I did that. Like, there were times where I would send a fax where we were getting ready to go for an appointment, and I would make sure that the surgeon got it before my mother got in, to let the surgeon know what we watched for the entire week, so she could ask better questions, not, or just probe where my mom wasn't going to be forthright with the information. Like, there's so much complexities to it. And, it's just so important, and so much stuff that you sitting there just can understand, like, when, again, doctors make rounds, it's important that you're there. If you can catch them, that's great. You can't always catch them, but if you can be there, that's awesome. Another thing people don't know, in New York State, you can tape doctor appointments on your cell phone. You just got to tell the doctor, and you're not taping it to get them in trouble. You're not taping it to catch them. But if you don't understand the medical jargon and it's a complex case, you might need to tape it just to better understand it going forward. Because a lot of times, if someone is that sick, they're not listening. My mom, I know from day one, she was just thinking about her mortality. Like, I just know that. Again, I think she was just going through the motions.
And Lisa,
I know I just gave you a lot, right?
It's. I have to say, I mean, it is overwhelming, and I didn't want to stop you, because you are just going, and it's just quite a lot. I mean, that you had endured, your mom specifically, your family, and this is probably, you're not the only case. I mean, thousands of people are probably going through the same day in, day out. They're just not talking about it, or maybe if they are, they're limited to the circles they do, and maybe their voice goes into the abyss and no one is actually responding to them. And I think your mission that you chose to take, really to just make it yours, is going to be a life changer for a lot of people. This message today, this show will probably change lives and guide them. And I wanted specifically to let you go through these different tips. And I know the book has much more to offer, and we're certainly going to share that with people. But I did want to go back, and kind of break down on, I know we're just about the hour, but I don't care.
That's okay, man. I'm flexible.
Yeah, we can go beyond. So I'm okay with that as well, because I think there's more here. I just wanted to just clear for folks, some of the new guys that might not know what taping is, just record it on your device. Because I know like some people are like, we're old school. I know what taping is, but some of the new generation may think, what the hell's that? You got to put tape on it, just joking.
Yeah.
So
no, the phone.
Yeah. Just record it on your device, whatever. But so first things first, there's some a lot of bad things happen, and also some good things happen. I want to highlight everything, but I think the first thing I want to start with is the preventative piece. And you said it. And by the way, you were right on the money when you said that generation specifically did not care about going to doctors. I had my dad, same thing, 73 years, never went to the doctor until the last moment where he was diagnosed with terminal prostate cancer. It was already done. So stage 4, it was metastasized, and that's it. So to your point, that is the biggest mistake in a lot of the generation. Well, that generation specifically. Now there's more of education about preventative measures, check-in, doing stuff. And these are good things that we didn't have back in then. One, it was just the taboo. Like the other one was, I want to live my life happy without knowing. And, and because when now you're disrupted and your mind is not the same. So
right.
So I think one of the things we can definitely just also emphasize today is the importance of preventative care, checkups, annual checkup, wellness visit. Make sure you check yourself, male, female, doesn't matter. Cancer is a real thing, is a threat. People die every day with this dilemma. People are diagnosed every day with this. I actually lost, my ex-wife passed with, breast cancer, and my dad passed with prostate cancer. So, and it's not a secret. I mean, and I've seen both, going through this almost the same ordeal, different scenarios, but similar, challenges. And it's tough. It is tough. And, I know everyone that has been afflicted with this will relate to this, because no one can actually understand it unless you've experienced it. You hear it is one thing, being in it is another story, and just seeing people deteriorate in front of you. And sometimes there's not much you can do. I mean, in your case, you had the power and you went through it and you really fought, and you were side by side doing the thing. And you're right, the system is made in a certain way. And if you don't know what you're doing, it will just manage itself, but then things may not work. So again, I want to highlight that first piece, which is, folks, if you're watching and listening, we wish you the best health and everything, and your family as well, but also be aware, take care of yourselves, make sure that your loved ones, do their checkups. Ladies, please do your, and that's it, pap smears, mammograms, all these things are done for a reason, as frequently. Age groups also, you need to be worry about, aware about when you have to do certain things and certain tests, colon cancer, colonoscopies, whatever, prostate, checkups. All these things are there as measures. And understand, the different protocols that are available to you. God forbid you have seen, something. Early prevention can actually be a long way. I mean, I know a lot of people that actually had the similar problem, but because it was detected at the onset, they were basically removed and nothing, the organs were done, and, no remission, everything was good. So it was perfect. But in the case of your mom, unfortunately, it was a little too late. But again, had she gone sooner, obviously, but again, we can't go back in time. It's unfortunate, but we can, educate other people to prevent this, and hopefully not experience what you have experienced. Now, the other part is there are some things I want to commend, here in the discussion, and there's some things that I want to really frown upon. So certainly you're right. I mean, unfortunately, healthcare, why it's a system, it is complex, and people are operating it. And when it comes to humans, they're good, the bad, the ugly, and some do, some don't. Sometimes they're overwhelmed too. Sometimes just the circumstances, so there's so many factors. So I don't want to judge, but there are certain things, to your point, that should have been done. I mean, first of all, the diagnosis was wrong. I mean, they should have done more. Now you didn't know that until, further down. And that's the other thing. When somebody is doing, go to second opinion, third opinion. I've had a few shows that we've talked about this where I had one guest who clearly 3 years was misdiagnosed. Mm-hmm. And, and everything that she was told and the treatment she was, going completely wrong, and she didn't have to. And so folks, be aware. I mean, don't just take your first opinion because you were told, because this is it. If you're not sure, and even for just to keep ease of mind, just go find somebody, go to a different system, a different doctor, find out for yourself. Second, third, get comfortable before you make that decision. And you know what? Ask for everything that you can ask for. Don't just settle for the first thing. Again, that's another advice I think that's aligned with you. And I think listening to you, it's important to make sure.
I tried to get my mom to. I wanted her to go down to the city, but she wasn't having it. She trusted, where we are. And would it have changed things? Probably not. But, I tried to get her to get a second opinion, but she wouldn't.
But again, you did, but she didn't. Yeah. But nevertheless, we need to make sure that at least our audiences, right. Take the first one. I mean, this is, she didn't, and then the outcome, we know. Right. Take it. You're not going to lose anything by getting a second opinion. And if you're worried about coverage and stuff, if you have insurance, that's going to take care of that anyway. So at the end of the day, you can also appeal these cases even with the insurance. If you don't think that the first diagnosis is correct, you can, ask for a second, and they have different protocols to do this as well. So don't, again, health is first before you can worry about the finances, because there's always ways to deal with that. I know that's a big deal, but certainly you have to deal with the situation, and you want to do the best for your, loved ones. And yourselves, God forbid, so it's important. Right. The other thing is, I want to tell you, I mean, you did mention something about the nurses, that you befriended, while you were there. And I have to say, I mean, the doctors, they're great. They, for the most part, they do their job, but then the nurses are the ones who manage the process. Absolutely. And you're right. They do a terrific job, and they are heroes. And you mentioned something post-COVID where today there's a shortage of them and things like that. And it's unfortunately how it turned out for the nurses. They were, with all these standing ovations and all the stuff, originally, and then all of a sudden they were like, oh, you didn't get your shots, whatever. Terrible. It turned. And something that you just alluded to, that is, when you talked about your neighbors, when you went and there's 20 beds and only 7 filled, and they say that's because it's not the capacity of those, it's the capacity of the staffing. There's not enough ratio staffing, and that's the problem. And I think that's the other part. Sometimes the nurses also get overwhelmed, but you're right. That doesn't justify attitude. That doesn't justify negligence. In your case, I mean, with your mom, the fact that she had a bracelet that is not hers, I mean, forget about it. That is not acceptable by any means. There's HIPAA violations there. There is patient rights violations. I mean, we can go over the laws here, and it's not even funny. That's why, I guess the CEO and the president would not even challenge you, because that goes to the news. If you went to the news, it's over. And so obviously to your point, they're probably 10 lawyers just do it. Just keep her at peace. Get
her out of your hair.
but I mean, that could be one scenario. It could be that he is, or she is, a good person and understand, truly understands, accountability, and, they did the best that they could and trying to, diffuse it, with the least, but certainly somebody, the idea from there, hopefully they would have, retrain and coach these staffs, and to make sure that there's protocols in place to prevent this thing. I mean, this is like, you're having a baby and they switch for your baby. I mean, it's the same thing. And you're right. All the diagnoses could be different. I know it happened.
I mean, I'm saying things I think today, like, I mean, just myself now, I mean, I don't know about you, if you've gone to a doctor lately, I mean, because even with the telehealth, because everybody's usually getting bracelets now, like in my experience, they ask every single person that comes into your room, lab technician, everybody looks at your bracelet before they give meds every single time. Even if you have the same nurse that's doing a 7-hour shift, every time she gives you medicine, she looks at the bracelet. Like, they're trained now to do that. This was 10 years ago, but it could have gone bad had they given her a med that was counteractive with what the meds that she was on. So it was a big oops. But again, I'm not trying to be cocky or arrogant. I mean, these are human beings. People make mistakes. I mean, that's just the name of the game. I think medicine is part science, part art. I mean, it's just people make mistakes, but the intent of this book is just to help people learn from what we did. And like what you said, I'm sorry about your dad and your ex-wife. The best part of the feedback that I've got on this book is, if you go to Amazon or if you go to my website, so many people write in and say, man, you wrote exactly how I felt, but just put it into words. Mm-hmm. And, one lady, it was one I got last week. It was kind of funny. It was a book buyer. And she said, I had a choice to make when I wrote the book. And, was I going to drop a few F-bombs or not? And I had to keep it real. I had to keep it me. So there's a couple sprinkled throughout. I don't go crazy with it, but there's a couple. And the lady wrote, she goes, I generally don't like when it's in writing. However, the way the author uses it and in the places that she uses it, it's as if she was my friend and we were talking on the phone in a conversation about what was going on. And she wrote, I think that every medical school should be mandatory reading for them. And that was like a great compliment, and again, I befriended a lady in Florida. She's got stage 4 ovarian and she's doing great. Believe it or not, she's not doing the protocol. She's doing food and light and supplements and
holistic.
Thank God she's doing great. And she's, a lot of people that have been through it like yourself, it does bring up some bad memories, but again, a lot of the feedback is, you put into words what I felt, which is good, but I also want them to learn and be able to have the ability to help their loved ones.
Well, thank you. And we're going to talk about that just briefly here, but I just wanted to, the concept of when I went through it, at least with my father, right, seeing him deteriorating and you standing with your mom and seeing her dropping literally quickly, in her age. Yeah. And sometimes feeling hopeless because there's nothing you can do. I mean, what you did was beyond. I mean, you really were her patient advocate and you're the caregiver in a way, but now you're taking that same thing, but now you almost broadcasting it to the world, and you're making sure that other people have you throughout your book as the advocate, right, and maybe teaching them how to be a better advocate to their loved ones and themselves, right, sometimes to speak up. One thing, I mean, we talked about diagnosis, we talked about the care and all the different things, but the other part is the choices. When you talked about, like, for example, you discovered this the wrong way. And that was a huge mishap. I mean, it shouldn't have happened that way. First of all, you don't just discover this like the person's coming out of space suit, and walking in, with hazardous, hazmat, suit, into the room and telling you like you have this and you didn't. That was super bad. That also psychologically will have a super impact, a bad impact on your mom to just find it that way. And now you have to make decisions. That's a tough one, right? It's very, very difficult. So again, unfortunately, it got missed, from the get-go. This should have been given to you guys in advance, knowing, and you have the ability to decide at the time, do we want to go to chemo? Do we want to do radiation? Do we want to do holistic and maybe nothing? Because at the end of the day, I have seen, and this is not me saying it, it is big discussion out there. Some people, when they do the chemo, they basically get deteriorated quicker than if they don't. And the outcome sometimes is still the same. Not everybody survives chemo. Sometimes the cells, you can do other means. And I've had people who have chosen the non-medicine, level, gone to like maybe Eastern medicine and holistic. They were able to kind of overcome the cancers and stuff. So, but that decision has to be, made in advance and not get into it. Because once you're in that cycle, again, when I talked about my ex-wife, and we were separated, but we were friends. It happened. And the first time she went through the whole thing and she was okay, but it was back, and then they gave her also another set, and then she just couldn't make it with that thing. I mean, it just destroyed her. And I can tell you, I've seen her like really getting again, bad and worse. And that's the part that is very difficult. And you want, again, it's as bad as it gets, so don't get caught up into it. Find out alternative medicine if you have to. And, again, they're going to do what they're going to do. Those are protocols, but there's a big debate about whether they are the right ones or not. Do they save lives? potentially they do. I mean, there's people that actually can swear by them, and they've gone through the protocols, and they had, survived, and they became better. But not everybody at her age. That's the other thing. Age can make a difference. Somebody is new is one thing, but might be younger, whatever. Somebody is older, that's a problem, right? So it all depends on a lot of circumstances. The other part is, when you're talking about the advanced directives, that's important also to emphasize the idea that, everybody should have, like I had a show about trust and will, about, proxies, you want to have these things in place. You never know. Right. I mean, whether it's your bank or your healthcare, it doesn't matter. You have to have documentation of what you want and what you don't, understand what that means. As a matter of fact, I just had a discussion like with my doctor last week. And, we talked about, like, for my mom and, even for me and my wife, and what should those documents be, and, what it means to have one versus the other, and to have them ready. So just in case, because like you're there today, and like with COVID, your point, people were here and they just wound up in hospital and can't even talk to their loved ones. And to your point, they're intubated. That's it, done. And that's the other part. Like, what do you do? I mean, it is a tough decision and so I had my doctor explain to me, like, what's the benefit of doing this? So you have the control. You can say yes, you can have them live with dignity, but you also have the ability to, no, I don't want to do this, I want to do this, right? So you have controls. And to your point, when she said that, he walked whatever he expected her to, his perception of what she stated. So again, these are important pointers, and I know you have all these details in the book. So it's super important that people can use it. I mean, the idea that you mentioned, I love it, that the book could be actually taught in med school. And maybe, people are listening and watching. If you are one of the executives out there, maybe, this is something, maybe be the first leader to maybe entertain it. Read the book, see what's in it. I mean, there's definitely value here, just listening to the story. And I haven't read the book, but I can just, from your perspective, it makes sense. I mean, and even if it's just an anecdotal book, let's just call it that way, right? For them, it's still going to be something. You always had to learn something. If you had experienced it, then maybe there's something to be done to prevent some of these things. For me, as a leader personally in an executive office, I can tell you, feedback is important to adjust things and make difference, right? So if you tell me, like, we do surveys all the time to see what's going on, what's wrong, so we can address those operational issues and training and so on, and coaching, so we don't, get the same problem over and over. As a matter of fact, so it is not a secret. You can read this. Consider this a survey book, right? Consider this an extra satisfaction survey, review. I mean, right now, reviews are the biggest thing, right? Everybody's about reviews. This is your biggest review. And from somebody, listen, I can give you, I had this true story happened to me a long time ago at a hospital where my mom had a surgery. They said they removed the gallbladder and everything. And then 7 years later, we discovered the gallbladder was still there. So I can tell you, I mean, it was like it's either a miracle and the thing regrew, or there was a mistake. But whatever it is, it was past the status, the status of what do you call it? Of limitations was actually past. The timeline. Statute of limitations was past its time frame, so we can do anything about it. And it's not even about lawsuits. It was just to address the issue and find out. But it was washed out, and I have it on video. I have all the stuff. And but the point is, I mean, like, sometimes don't be naive and just this. I learned that trick too, where when we trusted the system, and then we discovered that it was not really to our advantage at the time. So don't do your due diligence. Don't let anybody fool you. Just do it. It's not going to hurt you to do more, and just to make sure that you kind of cross the T's and dot the I's, and this way you're good. And then I want to also just focus on the topic of patient advocacy here. You're right. You was mentioning something powerful, that we have patient advocates in hospital systems, but the conflict piece is like, they have to be super ethical to actually still deliver, knowing that it's going to be even against their staff, and bring it to the board and bring it to the staff. Now they are trained to do that, but to your point, if they make too much noise at all times, then, there's a good chance they're not going to be employed eventually. Somehow, somewhere they'll find a way out. Right. So outside folks, the general public, you can be also your patient advocate and talk. I mean, you talked about your neighbor. I mean, that the fact that you went there and he was in that position, and it's horrible to see that. I mean, a lot of stuff that you mentioned is really butchered business. I mean, it's just bad business. And it's really because of just various reasons. I mean, if we go back in time and we can see what happened, everybody's going to give you a reason why it happened the way it happened, and everybody everybody sees we all see it from our angle, right? We don't see it from your lens. I'll see it from my version of things. We can say the same thing, but you see it one, I see it, you say this is yellow, I say no, it's orange, right? That's it. We can argue about it, but at the end of the day, you see it. So being a patient advocate is being a voice for people that cannot speak up for themselves. You're right. You articulated everything that everybody else, and that's the other thing. You see this all the time. You have 10 people that are seeing the same scenario, but nobody wants to talk about it because they're all like shy, or they're afraid of the backlash, what's going to happen. You're just brave enough to stand up and go to the room like, what the hell's going on here, right? That's exactly, I mean. I
changed I didn't name the facility. I changed the names. And, the funny thing is the GP who I called Dr. Cool in the book, he was one of the first persons I delivered the book to. And, I was a little nervous because it's a lot of his colleagues. And, I saw him about a month later. I'm like, so how'd you like it? He's like, I loved it. So I was like, great. My intent is not to, beat up these doctors. It's more of, just to raise awareness of the things that could happen, and they happen a lot. And there's ways that we can reduce the amount of times they happen. And, how, you can just by being there, by being present, by communicating, you really can have a significant positive impact on the outcome of your loved one. And not everybody has that person. But if you do, you're lucky, especially in days like this. I mean, COVID, when you could have no visitors, that's scary. Not only is it scary because it's a pandemic, it's scary because you can't see any of your family. Nobody knows what happened, and that's a whole nother show.
Well, it is. And unfortunately, after the pandemic, now we've learned a lot of tricks that we didn't know about before. Obviously we had to go through this ordeal and a lot of tragedy. I know that God forbid, if anything close enough happens, people will know to address it differently this time around, if ever, and hopefully that never. So I don't want to jinx it. Let's hope for a next few decades to have less. Maybe in 100 years, I don't know, but let's not wish bad on that. But the fact of the matter is, like, to your point, people went to the hospitals not knowing that they were going to be locked down, not knowing that they're going to be pushed out and their families will be down. So it happened so quick, and unfortunately, some people just didn't come back because circumstances, mistakes were made. There's so much discussion about that as well. It's not as obvious. You're not hearing about it on the main media, but you can read about it, blogs and articles. There are a lot of voices out there. But at the end of the day, to your point, these things, the books, the blogs. I love the blog. Maybe you and I can talk about that blog, of the air here. But the idea is really, I commend you for doing this and being a voice. And really, to your point, and thank you for saying. Listen, there's nothing wrong about making money from your production here, but at the end of the day, I think the message itself is the key. And like you said, you are articulating, you are stating what people are not able to, and also giving tips about what not to do and what to do correctly, so you can avoid any of the bad, experiences that you've gone through, you and your family and anybody else. And by the way, again, just something about, I want to just, in a good note, I don't think doctors do this maliciously because, it's their license. That's not what they do.
Yeah.
Things happen. It's just overwhelming, and, and there are no guarantees. They do the best. And I know that some experiences are what they are, but they do their best under the circumstances. And sometimes they also human. They can make misdiagnoses. They can do stuff. That's why it's always important to check, learn and do more. And frankly, they, like I said, at the time, they see it from their angle. They think that's the best course, or whatever, that's their learning, curve. Even doctors, if you see someone that is fairly new in the practice versus someone that's been 30 years, like, my last show, the advice is different. The actual demeanor is different from the providers because they know it differently. They have a different spin on things. They've been around, they've seen it all, and they understand different ways. Bad manners change, everything changes, right? So, it's that kind of thing. But at the end of the day, they try to help. And again, cancer specifically is, there's no immediate cure to it. Now, although
everybody's different, they probably have one of the toughest jobs
it is
ever. I can't even imagine being a pediatric oncologist. I did a lot of reading about, in some journals about, oncology and what they do and their training. And I softened up my tune, as you can see in the book. But, in the beginning, it was tough to get over some things. But, they have a hard job. And like you said, there's no guarantees. And, I think, 10 years later, I think that there's more people that are open to not only relying on Western medicine and looking to some Eastern medicine alternatives. There's so many things that they're finding out now. I mean, hopefully they'll just continue to, improve the game, and survival rates and stuff like that.
Well, I mean, there are breakthroughs every day, and they're getting there. I mean, I know, there are a lot of people that are anti-chemo and radiation therapy and stuff. Well, and although that has been the more, and then there's this debates about it and why, because it is a medical thing. It is it drugs, and there's also pharma involved in there. So there's, we can talk industry, we can talk politics, we can talk a lot of stuff that can be driving some of these decisions and some of these protocols. But there are many doctors, even that happened with COVID, vaccine versus no vaccine. And, some people are just for the standard, antibiotics and all this hydro and some of these other, medications that were, working in Europe. And so there's that debate. So that debate is always going to be there, and they're going to have both sides of the spectrum. Some are pro, some are against. But again, not the core of the discussion today. But the fact is, that people should look at all the options. I mean, I always say this. We have a choice in every day of life, and we have choices, not one, we have plenty of choices. We just have to explore each one of them and then make a good informed decision that makes sense. And then you can make that step, and whatever that trigger that you're going to pull, you pull it. But again, don't just go blind and just take the first, you can only do it this way. If that's the only way, then, I can assure you, there's no such thing as one way. There's many ways, there's multiple ways to skin a cat, right? There's so many ways you can do anything out there. And so just do stuff, reach out. And there are groups also out there that advocate for patients and things like that. But again, sometimes people get, by the way, I wanted to commend your work, the people that you work for, because understanding what you went through, that's true. Sometimes leadership, some employers can be, sensitive. There's empathy there. They care, and they accommodate, and sometimes cannot. But the fact that they were there for you, that's a beautiful thing. And again,
and I had a lot of responsibilities. I mean, I would travel around the country twice a week, and the EVP we were in Cube Life, and the EVP sat right on the other side of me, so he heard a lot of my phone calls, and he was just like, do what you got to do, and I. This Christmas, with my Christmas cards to a lot of the people that, were there for me, I sent them a book and, with something written inside of it, because, they were definitely game changers, for me. And I know that I was very lucky, because not many people would have had the latitude that I had to come and go as I needed to. And, almost the whole office showed up at my mom's wake. I was very, very lucky to work with and who I work through. I mean, and just to get to your point about different ways of doing things, and I know we're running late, but I met a woman recently that had a tumor behind her eye. She went to two very reputable surgeons in the city to get, what are we going to do? One doctor suggested to go through the eye and get the tumor out through the eye. Another doctor across town said that the best way to do it was to cut the top of her scalp off and get it through the top of the scalp, the tumor out the top of the head. And she wound up getting it through the eye. And when we were speaking, I talked to her, and and she made a statement that resonated with me. And she said her doctor said to her, if you're moving out of a house, do you move the furniture through the front door, or do you move it out the roof? I mean, that's how different suggestions and diagnoses can be. I mean, that's night and day. I mean, considering, going through the eye, then you're versus cutting off the top of one's head, and that's why, I mean, that's a like almost a 360, and that doesn't happen all the time, but it's why, as you said, insurance 9 out of 10 times will cover it, getting a second opinion. In fact, sometimes if you're really sick, they want you to, because it could potentially save them money if they get a different procedure. Maybe they get something done robotically that's cheaper, quicker, faster, and you're not an inpatient for a week, you're an inpatient for 3 days. Well, insurance, as you know, has a lot to do with it as well.
Well, I can go one more. I mean, insurance companies, they all have medical staff, and there's usually medical directors or chief medical officers and nurses on board. And surgeries don't happen overnight. You have to get authorization, and they have to look at the diagnosis and see what options are available. So sometimes they may refuse one, deny one, but then give you other alternative options that they see fit. So again, inquire. That's the thing. Know that you have the possibilities and you have the access. If you do it correctly, you should have very, smoother way of going about these things. But you have to speak up. That's the other thing. You don't speak, you're just, just no voice. I mean, you don't exist. You gotta, that's the thing. Having a voice and really advocating is the key. And again, like I said, I commend you for doing this. I mean, I'm sure it was to your point. You had a grief period, and I know it's a tough, time, and it took a minute. Everybody has their own, pace, how they can come out of it. Some people react differently. And I think you released all that, in the book, because now you
did. It was therapeutic. It definitely was. I was a nut. I had every single medical piece of paper file she had in a spreadsheet with everything it said. I had it all. And, I wasn't going to make the book where I used a lot of medical jargon, because that's not an average person's vocabulary. But, I didn't want to miss anything. I wanted everything to be, exactly the way things happened. And I even, again, it took longer because, in the beginning, I write a letter to my mother and I tell her what happened over the last 10 years and how I, as her daughter, screwed up as far as the way I grieved and the things that I did and just trying to, let my readers know that even someone with a fancy degree is not going to get it right, and just share that.
It has nothing to do with it. You can have all the degrees. Emotions are another story, and everybody's different. And there's religions, there's different levels of people and how they see the world, that, and, disease. And so everybody handled it differently. And you know what? You did it the way you could do it best. And eventually it gave us this book and a legacy. So in the memory of your mom, this is actually something that, is going to survive her and actually help a lot of people, and that in itself is a noble thing. And I think people will live by this over time, and many people will be actually happy about the fact that you did this, and that your grief wound up in the solution for a lot more to prevent them from grieving the way you did what is going through.
That's my goal.
Well, you're doing it. And so one thing, can you show, I think that's the book behind you. Is that the book behind you?
Oh yeah. It's my little green room. That's actually me on Myrtle Beach. My son took the picture, and I have a website, melissamullamphy.com, and I try and blog every day. I do newsletters, about emerging issues. So I try and at least once a day, react to something, and it's not all cancer. It's all over the place. This morning, today is National PTSD Awareness Day. So I just talked about that and, what our veterans are going through, and, certain organizations that are helping them. And, I try and stay on topic.
Well, thank you. So the book's name is Not in Vain.
A Promise Kept. Yep.
So I love that. Everything that happened did not happen in vain, and now people can actually benefit from it. And that's a really beautiful message right there, and a great name, great selection. So thank you for doing it. Well, listen, Melissa, it's been real. Thank you for this time. Like I said, I could have interrupted, but it was the flow was there, so I wanted to actually wait until the end. It's a little harder for me because I have to remember everything that I need to talk about. But we did it. I think you've delivered a great message for folks out there, and I think it was positive overall. Everybody, if you're doing something, not you shouldn't be doing, maybe it's time to learn and hopefully, adjust. That there's nothing wrong with that. We all can make mistakes and recoup. And if you know this in advance, you can even prevent things, whether in practice, whether in health. I mean, I think your message is just, resonating with everyone. So, so thank you for doing that and keep up the great work.
Thank you for having me. And, when I get the things we talked about going on my website with the questionnaires and the takeaways that folks can get, maybe we could reconnect.
Yes, definitely. I mean, we can do that. And so again, I will have the link to the book and your website on the description of the show, so people can actually access it directly, and hopefully they can benefit from it, and read it. Is there an electronic version of it, or just
Sure. Yeah, it's actually it's $1.99 on Kindle right now, and it's electric. Yeah, it's electronic. It's hard copy. It's soft copy. It's available, where all books are sold. You can get it on my website, you can get it on Instagram, you can get it on Facebook.
Beautiful.
Again, it's I'm very blessed with the feedback so far, and
it's real.
That's the whole thing. It was just, again, not to sound whatever, but I needed to keep it real, and I did, and it's the only way I've ever been able to be, even in corporate America. I never really fit the mold, but I was able to get through, and I had a great job, but I never really fit the corporate mold, and my friends would laugh at me about that, but it's just how I am.
You're straight up, and you don't do diplomacy. You just go right for the kill. And again, some people can be diplomatic, some people can, and that's okay. I mean, we need both parties, right? Both sides of the spectrum there. No worries there. You know what? I mean, you're doing it, and it's making a difference. That's what matters. That's all.
Yeah.
Well, Melissa, thank you so much for your time today, and I enjoyed every minute of this, and we'll keep in touch, folks. Thank you. Yeah, you're welcome. Folks, thank you for being with us, for watching and listening today. Hope this show is very educational, very, there's plenty of resource for you. So, check out the book, check out the site. And for me, we'll be talking soon. New guest, new day, new show, new topic. Bye for now.